Knock knock. Hello, my name's Haley. I'll be taking care of little Herbie here. Right now I'm just gonna go ahead and close the curtain, okay? And I'm gonna wash my hands. And I did see that little Herbie didn't have his first bath yet, which is totally fine. I'm just gonna go ahead and put some gloves on. Okay. Then before I get started, I just want to double check his ID band and same with yours, Mom, just to make sure that they match. Okay, thank you, and they do match. Now I did go over little Herbie's charts here, and he is 22 hours old, so 2 hours away from being 1 day old, and he was born about a week early, which is fine. And I did notice that he hasn't had a feeding in 6 hours due to a little bit of fussiness. So maybe after this head to toe assessment that I'm going to do, we can do some feeding and try with that. Because he hasn't had his first bowel movement, which usually we like to have at least one in a 24-hour period. So hopefully with after eating, that can kind of stimulate a bowel movement for little Herbie. Also, I did notice with his labs, his bilirubin is a little bit elevated. The normal range is about 6 to 8 for the first 24 hours, and his is at 12, but a lot of that bilirubin will be eliminated with his first bowel movement, which will lower those levels, so that is good. Okay, and he hasn't had his hearing test yet, but usually we like to do that after 24 hours anyways. Okay, so I will get started, and I'm going to do his vital signs first while he's a little bit calm. Okay, so I'm going to kind of expose his chest here to listen to his lung sounds and that apical pulse and his bowel sounds here. Okay. All right, and I'm just kind of listening to any crackles or wheezing. Okay, then I'm going to listen to his apical pulse for 1 full minute. All right. And his pulse rate is at 156 beats per minute, which is a little bit elevated, but still within normal limits, okay? And then I'll come down here to listen to his bowel sounds. Good. And I do hear rumbles in all 4 quadrants, which is good, but like I said, he didn't have his first bowel movement yet, so we will want that to happen. And I'm just gonna watch his respirations and count that for 1 full minute. Okay. That's at 58 breaths per minute, a little bit elevated, but still within normal range. Okay, now I'm gonna get a temperature on him. And I want to get it nice and snug underneath the arm. Kind of hold his arm down just so I get an accurate reading. Good, okay. Well, that is 36 degrees Celsius. It's a little bit on the low side, but maybe you and Herbie can do some skin to skin together to get him a little bit warmed up, and I'll keep this heat lamp on during this full assessment. Okay. He's a little bit fussy, and that's okay. Maybe a little bit cold, so all right. So now I am going to start from the head and kind of assess his head here. All right, just kind of feeling that the sutures, fontanelles, all that. Okay, now we have the anterior fontanelle here. It's kind of a diamond shape, and I can feel that. It's feeling fine. Back here's the posterior. It's kind of a triangular shape. Good. Just kind of feeling around for any like cephalohematoma, any of that, but everything looks good. His skin looks great. Now I'm going to assess the ears here. I'm gonna kind of, they're nice and firm. I'm gonna kind of fold them, and they do jump right back into place, which is great on both sides. And they look symmetrical, nice and even. Okay, and now I'm just kind of draw an imaginary line from the corner of his eye to the tip of his ear, the pinna. And that lines up perfect on both sides. Great. Okay. All right, and now I'm gonna just check out his eyes here. All right, now the iris is a nice deep blue and the sclera is a whitish bluish, which is normal. Okay, and I'm gonna kind of shine a light in both eyes just to see if they react. Good. Okay. Now I'm gonna check his rooting reflex here. And he does turn his head towards my finger, and he has a nice strong suck. Great. And then on this side, nice strong suck. Perfect. Good, good, good. I'm just gonna kind of feel around the hard palate and the soft palate, and he's gonna get a little fussy with this one. I'm just gonna check his gag reflex. Okay, we do have a good gag reflex. Sorry there, buddy. And nice good suck. Perfect. I'm just gonna check to see the clearance of his nares too. Hold one down. Good. Hold the other. Perfect. Those seem to be nice and clear. And the appearance of his lips, mouth, and everything, and his gums, nice pink and moist tone to it. Okay. Do a little bit of moving with his head here. Range of motion, and that seems to be going great. I'm gonna come down here to his neck here and feel around with the folds, check the skin, feel the lymph nodes to note any swelling, which everything seems to be looking just well. And his trachea is midline, so that's good. Perfect. All right, I'm gonna kind of open up the blanket again, a little cold. Okay. Just gonna kind of feel around his chest area, and his nipples are aligned with each other. A little bit puffy, but that is normal and should go down within a day or two. Okay, now with the arms, I'm gonna kind of check the brachial pulses here. And those are strong and even on both sides. Okay, and I'm gonna check it with the femoral pulse as well. Okay, strong and even, perfect. Okay. Do a little bit of range of motion with his arms, and we're just kind of checking for any signs of like a fracture or anything, or issues with the shoulders. And I don't hear any clicking or anything, so that is great. I'm gonna kind of feel around at the clavicle site too. And it's sometimes common for a fracture in the clavicle with birth, but that seems to be just fine as well. Gonna feel around on his abdomen here. Any distension, swelling, anything like that? Nope. Seems to be good. And then now with his umbilical cord, I do see the 2 arteries in the vein, which is great. You do want to see that. And I don't notice any redness or swelling on the site or any excess drainage. Now with the cord care, we used to do alcohol to help dry it out, but you don't even have to do any of that. You just leave it alone and try to keep it dry from the diaper and everything, and it should fall off in about 2 weeks or so. I'm gonna have him grasp my finger, or on both sides. Nice strong grasp, kind of pull up. Good. Okay. Gonna get a little bit cold. Now I'm gonna undo his little brief here. And I did see that he was circumcised about an hour ago. There is a little bit of blood in the brief, which is normal, but if there is any more major increase in blood, major swelling or irritation, odor, do let us know. But everything looks great. And let's see, checking the skin. And the urethra is nice at midline, and the testes are nice and distended, so good. And I'm just gonna kind of lift your bottom up here, buddy. Check that bottom, and we do have an anus. And like I said, you know, no bowel movement yet, but okay. And also with the Circ Care, you do want to put a lot of petroleum jelly in the brief and also on the penis. This prevents sticking with the blood to the diaper, which can, of course, hurt little Herbie here. And also you want to just kind of fold the diaper here and not cover the umbilical cord, just because the chance of saturated brief and it soaking into the cord there, that could be very irritating, and you don't want to cause major friction there. So now we'll go down to the legs, check the femoral pulses on both sides, and those are strong and even. I'm going to do a little bit of range of motion with the legs here, checking for any clicking or signs of hip dysplasia, and none is noted, so that's great. And the legs are equal in length. Good. I'm going to come down here and let's see. I'm going to check his Babinski reflex. Good. And he wraps his little toes around my finger on this side. Good. He wraps his toes around my finger. And I count 5 little toes on each foot and 5 fingers on each hand. Good. Okay, and I do want to go ahead and check the circumference of little Herbie's head here. Okay, got 36 centimeters for that. And then around his chest here at the nipple line, and I have 32 centimeters for that. And it's normal for the, you do want the chest circumference to be smaller than the head circumference. You measure the head circumference at the eyebrow line. Okay? Now I'm going to just turn little Herbie over for a second. Okay, good. I'm just checking his spine to make sure that it's midline and even. And it does have a little dimple there, but it is closed, which is a great sign. And the creases in both legs look to be even. And if they weren't, that could be a sign of hip dysplasia. So we're looking good right there. Okay. Now I do want to check his moral reflexes. I'm going to kind of lift him up, and he might get a little bit scared, but drop. Okay, he did react to that. And then I just want to snap over here. He did react. Snap over here. Good. All right. Now I do want to wrap little Herbie back up so he's nice and warm. All right. I'm just looking at his notes again. And I did notice that he has a 11.8% weight loss, which is probably due to the 6 hours of not being fed due to his fussiness. So it's kind of expected for that. And we do really want to make sure that he has that bowel movement, so hopefully after the feeding, like I said. And then to warm him up a bit, some skin to skin with mom. And then I know you were asking about the erythromycin. Now that medication is an ointment that goes in both eyes of baby right after they're born within about an hour. And that just is kind of like a prophylactic drug to prevent blindness from a bacterial infection, usually gonorrhea or chlamydia. Okay? So now we're nice and warm and toasty. Now, do you have any questions for me, Mom? No? Okay. And I did notice that his crib, he had nothing in there, and he had a tight fitted sheet on the mattress, which is perfect. You don't want any excess things or anything around his face that could potentially suffocate him. So we're doing a great job with that, Mom. All right. And any questions again? Nope. All right. Thank you.